I can't do anything. I can hardly walk.
March 11 marks the second National Day of Remembrance for victims of COVID-19 in Quebec. 2 years into a pandemic that overwhelmed the healthcare system, hospitals are slowly climbing out of some of the toughest times they've ever seen. Thousands in the province have been left waiting for care, especially surgeries. Wait lists were already long, but COVID made it even worse. Non-urgent surgeries pushed, but non-urgent doesn't mean no pain.
I haven't really been complaining, but the pain gets worse and worse, and my knee surgery gets put off, and it's a real problem.
Katy de Volpi is among the nearly 160,000 patients Quebec says are waiting for surgeries as of the end of January. Her knee replacement postponed twice due to the pandemic.
And I feel very sympathetic towards the people who have far more bigger problems than I do. A knee is nothing when there's people with cancer and all sorts of things that need surgery. But it's my turn. I want to go.
With orthopedic and knee and hip and spine problems, people tend to suffer, but in some ways they can just reduce their level of activities, use painkillers, anti-inflammatory drugs, and they'll somewhat be able to cope with it for a time or for a longer period. So that's one of the reasons why those surgeries can be pushed back and being replaced by surgeries that really are more life-threatening.
About 3,500 patients in Quebec have been waiting for surgery more than 2 years. Montreal public health officials are looking to cut waiting lists in half by 2023, but some say every second counts. 32-year-old Shiny Sarabanamutu has lived with retinitis pigmentosa for over 10 years. It's a rare eye disease, and a hole was discovered in her eye days before the pandemic initially shut the province down in 2020. As it was considered non-life-threatening, she wasn't prioritized, and now they'll be unable to restore the vision she's lost.
If you're a normally sighted person and you have a hole and they fill the hole, you'll get the vision back. So for me, now, if I cover my left eye, my right eye is still very blurry. I haven't restored vision. I wish I kind of had it earlier. I don't know if I would have got some vision back, or had I not lost some of that vision during the waiting period, that kind of would have been nice. But there was a pandemic. We were low on resources. So I do understand. It's just timing of it all just sucked.
Eventually, 2 surgeries were done to fill the hole in her eye. As for the Volpi, her knee replacement is now scheduled for May, hoping she'll heal quickly after surgery.
And then I have to get home and get down to my house, which is 52 stairs down to my house. So anyhow, I guess I'll slide down the stairs if there's still snow.
In Montreal, Pamela Pagano, City News.